Dental health is so important that they have literally their own field for it. But there is a lot of, you could say, disconnect between, especially in a hospital. I think I've only had maybe, I want to say 2 or 3 patients in my whole nursing career where we had somebody come in to do a tooth extraction. There was one guy that had endocarditis that we're going to talk about later, that needed to get a few of his teeth removed. And then I know for before we place an LVAD, we make sure you have good oral health as well. So sometimes we have somebody that comes in, a dentist, to take off those teeth as well before we put them into surgery and put an LVAD in them, because having an artificial device in you increases your risk for infection, for blood clotting. So you want to prime you up to get this surgery. And that's one thing I just reflect on right now, because I completely forgot. We always did oral checks. Not us as nurses, we did like the oral care, but we always had the patient be evaluated by a dentist or or an oral surgeon, or somebody that does oral care and health for a living. So that's how important it is. And unfortunately, it's one of those chronic diseases like diabetes and cardiovascular disease, where it's not just like one day you wake up and you have a meth mouth going on, right? You don't just go to sleep one day and then next morning you have 4 or 5 teeth missing. It's not like that kind of acute thing. It's a chronic thing that happens over time. And, and not incidentally, unfortunately, it is the patient's fault that they don't do this. Not something that, you get a pill for. You get a pill for the pain, but no one's going to come in your home and brush your teeth for you and take care of your diet and cook for you. It's something that you have to take initiative, just like with anything else in life. A lot of these are preventable. It's just how well are you preventing it? And a crazy stat is that more than 1 in 4 of adults in the US alone have untreated tooth decay. That tooth decay is not severe enough for people to notice and to cause pain, but it is occurring there. Like we said in the beginning of the show, poor oral health and all that stuff is more of like a outside of US phenomenon, but this just shows you that we still have some fixing to do. I know greatly that the oral care has definitely improved in the US, especially for kids. I remember back in the day, like 2005, 2006, so I want to say, time frame, I always used to see a bunch of commercials on TV about brushing your teeth, about oral health. So I feel like the CDC and the World Health Organization at least did a pretty good job of kind of lowering the effects of poor dental hygiene on kids.
Yeah, and if we look at like the mouth being this organ and it's being part of the digestive system, we can really relate to like the microbiota of the gut, where hey, there's healthy gut bacteria, but once things happen such as inflammation, the good bacteria are opportunistic and could lead to problems in other parts of the body. And same thing here, there's natural healthy bacteria in the mouth that's formulating, but if you're not taking care of your mouth, this bacteria is going to find a home somewhere else, and that could lead to problems. Just like gingivitis, you have, and periodontitis, you have a receding gum. Our teeth have so much vasculature and blood vessels all connected. So if you have receding gums, which are protecting that part of the tooth where all the blood vessels are, now the bacteria could tap into the bloodstream. They're going to go find a home somewhere else, and they're going to cause chronic issues. What if like there's a correlation between bacteria constantly being in the bloodstream, entering the mouth? Now you have the immune system constantly trying to clear that up, and that's leading to atherosclerosis and plaque. We unfortunately are still behind on the human body and its capabilities, and we're still kind of finding stuff out as we're going. But what if that's a connection that we're missing in our society? So yeah, it's crazy to think about.
You never know. And as you all know, that once healthcare is always going to innovate. So the more we innovate, the more we revolutionize healthcare and treatments and prevention. We slowly start to learn about this and how we're all connected. If you want to watch or listen to our latest episode,
You can check us out on Apple, Spotify, or watch us on YouTube.